screen. Okay, excellent. Oh my goodness. All right, thanks. So let's talk about, so this is part 1 of six parts. This is a series of 6. So let's start talking about how to create change in your clinic without generating conflict, attracting bad attitudes, or feeling insignificant. And unfortunately, this is a common theme in a lot of veterinary clinics. You, as the practice manager, want to create changes, and oftentimes you need to create changes, but you're consistently met with resistance. Resistance in the form of, say, bad attitudes, cold shoulders, eye rolling, back talking, gossiping, or nothing. And it can definitely leave you feeling deflated, unappreciated, unfulfilled, or worse yet, insignificant and disrespected. So I want to help you change that. Let's get you heard, let's get you respected, and let's get you appreciated. With that, there are 6 steps to creating change. The first part of creating change, of any change, doesn't matter what it is the correct setup. And that's what we'll talk about today. So part 1 of creating change is the setup. And the setup has 3 components to it. The first part is where you think about and get clarity on the change or changes that you want to implement. It's like writing a book. First, you need to know what you want to write about. So get clear on the change you want to implement. And then the second component is you need to figure out what your part is in creating this change. Again, think about this book. Will you have an active role as one of the characters? Will you be the hero or the villain? I'm assuming the hero. And what will that look like? And what do you need to have that happen? Then you need to set up your team for their part in the change or changes you want to create, like the supporting characters in your book. And by the way, before I forget, try to create one change at a time. I'd rather see you implement one tiny change every week than several changes all at once every month or, several times throughout the year. So let's talk about component number 1, the clarity of your setup. This is the most important part. So really take the time to think it through and be clear on what you want to achieve. And here are a few questions you should ask yourself every time you want to implement any changes. Number 1, why is this change important? And you need to be able to answer this question easily and generously, meaning give as much information as you possibly can. And don't get offended by the questions. Well, why? Why do I have to do this? How come it's been working like this for a really long time? Why do I have to change that now? So be really generous with your answers to the question. Why is this change important? Number 2, what will the outcome be once you have implemented this change? Think about that. Number 3, what will this outcome create for your clinic, for your staff, for your patients, for your clients, and so on? Really think about that. Number 4, how will the end result of this change impact the feel of your clinic? How will everybody feel? What will their emotional state be? And don't skip over this question. It's important. And if you remember the webinar on the personalities, you can go back to that and then you can divide your team members into the different quadrants. I would suggest you do that anyway. Just have a piece of paper with the 4 quadrants and just start plugging in each team member into the different quadrant. But once you have the team members divided into the different quadrants, then you can figure out how this change will affect their different personalities. And then number 5, another important question: why should they care? So you might feel that this is too much work for each little change, but if you do it often, it will become less work. It will become easier. It'll become much quicker. And if you don't have the time to do it right the first time, when will you have the time to do it over? When will you have the time to fix it? Because right now, this is where you're at. So going to component number 2, which is, what's your part in this change? First of all, you need to be the mastermind and think it through. Number 2, you need to find your support team. Don't make changes by yourself. You need backup. You wouldn't write a book without someone to check your facts, without an editor, without a publisher, etc. Especially when these changes are huge, but not only when they're huge. Any change, you need to have somebody's input, and somebody needs to have your back, your support system. But especially when those changes are huge, you want to make sure that you have a huge support team. The bigger the change, the bigger your support team. Number 3, you need to lead the way. Whatever you change, you need to implement. And I was called about a medical director once who kept making all of these policy changes. This was in an emergency clinic. And one of the policy changes that he made was every doctor needed a DA, a doctor's assistant, in the exam room with him or her at all times. So if a patient came in, imagine an emergency clinic, patient came in, everybody's upset. Client and patient, owner and patient came in, there needed to be not only the doctor in the exam room, obviously checking out the patient, but also a DA, a doctor's assistant. That was a new policy, except he, the medical director, wanted to be alone in the exam room with the client and the patient. He didn't want the DA. He didn't want a DA. He didn't want another person in there. The room got too crowded for him, or whatever his reason was. But of course, that whole policy flew out the window because he didn't enforce it for himself. So he wasn't leading the way. He didn't implement the change, but he expected everybody else to implement it. And of course, it didn't happen. Number 4, you need to set your team up for success. I'll let you just think about that, what that means for you and for your clinic and for your team. Number 5, you need to find and give value to your change, or it won't happen. If it isn't meaningful, it won't happen. The last component to the setup process is, what's their part in the change process? The big one here is what's expected of them. And be really specific what you expect from them in implementing this change or these changes, and how the change will make their lives easier, more rewarding, more fulfilling. And if it doesn't cause a change in their lives, if it's just giving value to your patients or your clients, then make sure that your team sees the value in that. And then have that other conversation about, if they don't want to implement the change, what consequences that will have for them, for their job, for the clinic, for the client, for the patient. Be very specific in that. The best that you can do in your setup is to avoid unfulfilled expectations. So if there's only a couple of things that you take away from this webinar, it's 1, be really clear about your change, what you want to achieve with the change and how it affects your team, and then avoid unfulfilled expectations. So to recap, the most important step in the 6-step process of creating changes within your clinic is the setup process, which includes being clear about your change and its outcome, knowing what's your part in this change process, knowing what's their part in the change process. and always set your team up for success. So next week, I'll talk about part 2 of how to create change in your clinic without generating conflict, attracting bad attitudes, or feeling insignificant, which is the delivery, as I call it. How will you deliver the change that you want to create? How will you deliver it to your team? So in the meantime, if you have any questions, send them to me via email, through LinkedIn, preferably on our LinkedIn group, Beyond Veterinary Practice Management. I'm trying to get a little bit more involved in that and have some back and forth in there, or through my Facebook page, which is Design, Business, and Life Coaching. So that was about 10 minutes, and we'll have another 10 minutes session, a tidbit, Thursday tidbit next week. Have to get used to that name. Until then, I'm Dr. Young, Dr. Heike Young. I'll see you again next week.